Hello everyone and welcome to today's presentation. I'm excited to introduce our topic, amitriptyline. On this first slide, we'll see the title clearly displayed. Over the next few minutes, we'll explore what amitriptyline is, how it's used, and some key facts you should know. So let's get started. Let's take a look at a typical clinical scenario involving neuropathic pain relief. Here we have a 54-year-old woman who comes into the pain clinic, and she's experiencing severe postherpetic neuralgia. She describes her nights as being unbearable, saying she can't sleep because of a burning pain. This highlights how neuropathic pain can seriously impact quality of life, especially sleep. Initially, she was treated with gabapentin, which helped only partially. This is a common situation where first-line treatments might not fully control the pain. So the physician decided to start her on a low dose of amitriptyline taken at night. The goal here is twofold: to help ease her pain and to improve her sleep quality. This scenario underscores the importance of tailoring pain management strategies to individual needs and adjusting treatments when necessary. It also connects to our broader discussion about managing neuropathic pain effectively, using different medications and approaches to improve patient outcomes. Let's look at this clinical scenario involving depression with insomnia. We have a 28-year-old man diagnosed with major depressive disorder. He's feeling hopeless, which is a common symptom, and he's also experiencing sleep problems. Specifically, he wakes up very early every morning, which can worsen his overall functioning. Initially, he was treated with SSRIs, which are often the first-line medications for depression. However, in his case, these trials didn't lead to the desired improvement. When SSRIs aren't effective, we need to consider alternative options. This is where amitriptyline comes into play. It's a tricyclic antidepressant that not only helps elevate mood, but also has sedative properties. This dual benefit makes it especially useful in patients like this, who are struggling not just with depression, but also with sleep disturbances. By choosing amitriptyline, his psychiatrist aims to address both issues simultaneously, improving his mood while helping him get better sleep at night. This example highlights the importance of tailoring treatment to specific symptoms, especially when initial therapies don't succeed. Imagine a teenager rushed into the ER after ingesting an entire strip of amitriptyline tablets. This is a classic overdose scenario that we need to be prepared for. As you can see, he's drowsy and hypotensive, which indicates significant central nervous system depression and circulatory compromise. His ECG shows a widened QRS complex, a key sign of cardiotoxicity caused by the overdose. In such emergencies, rapid intervention is crucial. The emergency team quickly administers intravenous sodium bicarbonate. This treatment helps to reverse the cardiotoxic effects, particularly the widened QRS, by stabilizing the cardiac cell membranes and overcoming the sodium channel blockade caused by amitriptyline. This scenario highlights the importance of recognizing overdose symptoms early and understanding the role of sodium bicarbonate in managing cardiac toxicity. It ties into our overall theme of prompt, targeted treatment to prevent serious complications in poisoning cases. Let's take a closer look at how amitriptyline works. It's classified as a tertiary amine tricyclic antidepressant, or TCA for short. Its primary action involves inhibiting the reuptake of serotonin, also known as 5-HT, and norepinephrine, or NE. By blocking these reuptake processes, amitriptyline effectively increases the levels of these neurotransmitters in the synaptic cleft, which helps improve mood and alleviate symptoms of depression. But that's not all. It also blocks other receptors, including muscarinic, histamine H1, and alpha-1 adrenergic receptors. This receptor blockade is responsible for some of the drug's side effects, such as sedation and anticholinergic effects like dry mouth, blurred vision, and urinary retention. Additionally, amitriptyline is metabolized in the liver into its active form, norepinephrine, which continues to exert therapeutic effects. Understanding this mechanism of action helps us appreciate both the benefits and potential side effects of amitriptyline, and how it fits into the broader context of antidepressant therapy. All right, let's take a look at some of the key clinical uses of this medication. It's particularly effective in treating major depressive disorder, especially the melancholic type, which often involves more severe symptoms like lack of pleasure and early morning awakening. Beyond depression, it's also used for neuropathic pain syndromes, such as postherpetic neuralgia and diabetic neuropathy, where nerve pain can be quite debilitating. Another important use is for migraine prophylaxis, helping to reduce the frequency and severity of migraines. Additionally, it can be beneficial for sleep disturbances that are linked with depression or chronic pain, helping improve overall quality of life. Connecting this to our broader discussion, these diverse applications highlight how this medication's unique properties make it valuable across a range of conditions, especially those involving mood, pain, and sleep issues. Let's take a closer look at the dosage overview. For depression, the typical starting dose is between 50 and 150 milligrams per day. The key here is to start low and then gradually increase the dose as needed, monitoring how the patient responds. When it comes to pain or migraines, the usual starting dose is around 10 to 25 milligrams at bedtime. From there, the dose can be increased gradually, but most patients tend to stay at or below 75 milligrams per day. These dosing guidelines are important because they help us tailor the treatment to each patient's needs, ensuring both effectiveness and safety. Remember, the goal is always to find the right balance, starting low, titrating carefully, and adjusting as necessary, all while keeping the patient's overall well-being in focus. Let's now take a look at some of the adverse effects associated with these medications. First, we have anticholinergic effects. These include dry mouth, which is quite common, constipation, blurred vision, and urinary retention. These happen because anticholinergics block parasympathetic activity, affecting various bodily functions. Next, there's the sedative effect, which occurs due to H1 receptor blockade. This can lead to drowsiness or fatigue, especially in sensitive individuals. We also need to consider orthostatic hypotension, which results from alpha-1 blockade. This can cause a sudden drop in blood pressure when standing up, leading to dizziness or even falls. Another important point is cardiotoxicity. These drugs can cause widened QRS complexes on an ECG and arrhythmias because of sodium channel blockade. This is a serious concern and needs close monitoring. Finally, there's the impact on the central nervous system. These medications can lower the seizure threshold, meaning seizures become more likely. They might also cause confusion or delirium, particularly in elderly patients, which highlights the importance of cautious use in that population. Overall, understanding these adverse effects helps us weigh the benefits and risks of these drugs in our treatment plans. Let's talk about contraindications and cautions to keep in mind. First, it's important to avoid this medication if the patient is taking MAO inhibitors, because combining them can increase the risk of serotonin syndrome, which is a serious and potentially life-threatening condition. Next, we should be cautious when prescribing to elderly patients. They are more prone to falls and delirium, so careful assessment is necessary. It's also contraindicated in patients with certain conditions like cardiac disease, glaucoma, or urinary retention. These conditions can be aggravated by this medication, so we need to evaluate each patient's health status thoroughly. For patients considered high risk, it's recommended to perform an ECG before starting treatment. This helps us identify any underlying cardiac issues that might be affected by the medication. Overall, understanding these contraindications helps us ensure patient safety while aiming for effective treatment. Let's go over the key emergency points in overdose management. One of the classic signs to look for is the triad: coma, convulsions, and cardiotoxicity. Recognizing these symptoms quickly can really make a difference in patient outcomes. When it comes to treatment, the first step is always ensuring the airway is supported and that cardiac monitoring is in place. Keeping the airway open and monitoring heart function are critical in managing these cases. A mainstay treatment for cardiotoxicity is IV sodium bicarbonate. It helps narrow the QRS complex on the ECG, which is essential to prevent further cardiac issues. For seizures, benzodiazepines are our go-to medications. They're effective and fast-acting in controlling convulsions. However, it's important to note what to avoid, specifically physostigmine and flumazenil. These agents can sometimes worsen the situation or cause adverse effects in overdose cases, so their use should be carefully reconsidered. Understanding these key points forms an important part of our overall approach to overdose emergencies, ensuring timely and effective intervention. Let's take a moment to discuss some important clinical pearls. First, when we look at tertiary TCAs like amitriptyline, they tend to cause more sedation and have stronger anticholinergic effects compared to secondary TCAs such as norepinephrine. This is something to keep in mind when choosing the right medication for a patient. Second, using low-dose amitriptyline can be quite effective in managing chronic neuropathic pain. An added benefit is that it can also help improve sleep, which is often disrupted in these patients. These points highlight how tailoring TCA therapy can optimize both pain control and quality of life, fitting into our broader goal of personalized pain management strategies. Let's think of Amy's trip as a helpful mnemonic. Amy's trip, to remember some key points about certain medications. Imagine Amy is carrying two bags, one labeled 5-HT and the other NE, which stand for serotonin and norepinephrine reuptake inhibition. This helps us recall drugs that work by blocking the reuptake of these neurotransmitters, increasing their levels in the brain. Now, as she travels on her trip, each part of the mnemonic highlights a different characteristic. The A stands for having dry mouth, which is a common anticholinergic side effect. It's important because it reminds us that some medications can cause dryness and other anticholinergic effects. Next, the M indicates that this drug can lift mood, making it useful in depression. Then, Y stands for yawning, which can be a sign of sedation or drowsiness caused by these medications. Moving on, T signifies that the drug is a tertiary amine, meaning it tends to be more sedating and anticholinergic compared to secondary amines. The R is for reuptake inhibition of both 5-HT and NE, which is the main mechanism behind many antidepressants. The I points out that these drugs are also indicated for pain management, broadening their therapeutic uses. Finally, the P reminds us that in cases of poisoning, bicarbonate can be used as an antidote, especially for overdose situations. Overall, this mnemonic helps us remember the key features and side effects of these medications, connecting their pharmacology to clinical practice, and emphasizing how they influence mood, pain, and potential toxicity. Let's go over some key highlights for exams and practical applications. When it comes to TCA overdose, remember the 3 Cs: coma, convulsions, and cardiotoxicity. These are the main clues you'll see clinically and are crucial for early recognition and management. On the therapy side, it's important to note that tertiary TCAs tend to have more anticholinergic effects, which can influence how we approach treatment and manage side effects. As for practical pearls, low-dose nighttime use of TCAs can be beneficial for neuropathic pain and preventing migraines. This reflects their versatility and the importance of dosing strategies tailored to specific conditions. Connecting all these points to our overall theme, understanding these highlights helps us better assess, treat, and manage patients dealing with TCA-related issues, ensuring safer and more effective care. Let's wrap up with a quick summary. Amitriptyline is a versatile medication. It's a sedating tricyclic antidepressant that really bridges the fields of psychiatry and pain management. Understanding its mechanism of action is crucial, especially how it affects neurotransmitters, and being aware of its toxic triad is vital for recognizing overdose situations. Additionally, knowing that bicarbonate serves as an effective antidote can make a real difference in management. These points come up frequently, both in exams and in everyday clinical practice, so having a solid grasp on them will serve you well. Remember, the key is understanding how these components connect within the broader context of patient care.